Do you have frozen shoulder and you've been given your options? Either they're not working or you're looking for something else. Let's talk about a really cool procedure that we can do that can help, that has less downtime generally and can have some really good outcomes as well. So, frozen shoulder is a condition where the joint capsule around the shoulder, when your shoulder gets injured, or it can just happen. Generally, older females with hypothyroidism or adults with diabetes are more at risk of this. The capsule contracts down really tight around that shoulder and prevents range of motion in that shoulder. It's a protective mechanism because it's recognized that I don't like what's going on here. This is painful. So I'm going to just clamp down real hard and not move the shoulder, essentially. So, a couple treatment options: physical therapy, doing some mobility, soft tissue work, that can be helpful. Another approach is called manipulation under anesthesia, where they literally put you to sleep and they move your shoulder because if you were awake, it would be too painful. Our option is called a hydrodilatation, where we actually go in with a needle inside of the joint capsule and we inject a large volume of fluid, whether that's 5% dextrose, which is basically like a low concentration sugar water that's soothing to tissues, or we can do plasma and PRP to help stimulate a healing response on top of that. But the goal there is to stretch the capsule from the inside out and then do some of that mobility. And so we're actually getting in there, physically stretching it, moving it around. And there's a lot of really good research on this, and clinically, we get great results. So, this is something you've been struggling with. These things can last a long time, and you want another option or a different option, feel free to reach out to the practice. We can do a free 15-minute discovery call and see if you are a good candidate for this.